Advancements in both technique and technology have made aesthetic plastic surgery safer and more affordable and less invasive than ever before. However, many who desire plastic surgery still remain on the fence with questions regarding the safety and effectiveness of their desired procedure, along with questions surrounding their own motivations for seeking treatment. Here is Dr. Daiza with more.
Occasionally I will have patients come in and say, I'm not really looking to do this, but my husband wants me to do it, or my mom's been bothering me and telling me that I need to have this done, or my friends tell me, you know, I look this way or that way. And that's really not the right reason to have plastic surgery. A red flag will go up if it's not a procedure you're having done for yourself and because you want that and you want to make yourself better, then it's not the right procedure. Plastic surgery doesn't have to be radical. It can be just fine-tuning what we have and making things a little bit better. I want my patients to be happy with their procedure. I like to get an idea of what they're looking for, what they're expecting, what they're hoping for.
I think a lot of doctors don't listen and don't take the time. It is really, really frustrating, especially when it's such a personal thing what we're doing here with the doctors. I mean, it's a privilege for both of us. A
lot of my patients come in and they're just frustrated. And they come in and they say, you know, I diet, I exercise, I work out with a trainer, I've been exercising, I do, you know, 500 sit-ups a day, and I can't get rid of this big fat tummy. So I really like to spend a lot of time with my patients. I like to really educate, because I think if they understand what's going on, it makes them aware of why they can't fix the problem on their own. I take a lot of time to explain the fact that a lot of these changes can't be changed without plastic surgery.
I worked out for years trying to get rid of my little saddlebags on my sides. I mean, marathons, century rides, big time stuff.
The main changes that occur with the tummy, the skin stretches out. Once we've stretched out the skin, we lose the elasticity. All the dieting, all the exercising in the world will not get rid of that skin. The other big change that occurs, and I think this is where most women get frustrated, is the muscles of the abdominal wall stretch out as well and separate. And again, I tell them, you know, you can do all the Pilates in the world, all the sit-ups in the world, and those muscle edges won't come back together. So without surgery, that's not going to be effective. So with surgery, or with a tummy tuck, we actually go in and repair those muscle edges and bring them back together. And then remove any extra skin that's there, and then give that appearance of a nice flat tight belly with a nice hourglass shape. Another common complaint that goes hand in hand with the tummy complaints is the breast. Many of my patients again come in after pregnancy or after massive weight loss, complaining that the breasts have started to sag or going down towards the floor, as they call it. And I always tell them that, you know, again, it's not reversible without a surgical procedure. This is what we refer to as breastosis, or sagging of the breast tissue. A lot of times this will require a breast lift. If the patients have just lost some breast volume, then we can correct that by adding an implant. We now have the FDA-approved silicone implants, which look and feel very natural. A mommy makeover is not just for mommies. It can be for anybody. So anybody who has lost weight or had major weight changes, or just even with time, again, gravity, I always tell my patients, gravity always wins. So I have many patients that come in, they've not had children, they've maybe had some weight changes in the past, or maybe not even much in terms of weight change, but the breast may sag over time. As we get older, we do lose elasticity in all parts of the body, the face, the breast, the entire body. So plastic surgery, or the mommy makeover, or body contouring as we call it, is not just for post-pregnancy changes. Plastic surgery is not just for women. I have a lot of male patients. I'm seeing more male patients come in now, a lot of times again just for facial rejuvenation, not necessarily surgical procedures. I think a lot of that is due to men and women staying out in the workforce much longer these days. I have a lot of men coming in and they say, well, I'm competing with these much younger men are out there, and I need to keep the refreshed look. I see a lot of men now for non-surgical facial rejuvenation or procedures, Botox, Dysport, fillers, peels, skincare. I think before it used to be something that was, you know, a girly thing or only women would do, but it's really not uncommon now. I have a lot of couples that come in together for their treatments. I think it's important also for patients to know that Some of the non-invasive procedures can actually cause disfigurement or may not give the best result if not performed by the right person. Patients also come to me for revision work. I've seen patients who come in who've had anywhere from 1, 2, even 4 or 5 revisions or attempts at revisions by other surgeons who may not have actually been board-certified plastic surgeons. These patients come in, basically they're discouraged, they're hopeless, they feel disfigured, deformed, and just don't know how to keep going. It's very gratifying for me to be able to successfully revise the surgery, whether it be on the face, the breast, the tummy, the extremity, and give these people hope and give them their life back. I'm very conservative with the way I practice medicine. I like very natural results. I want my patients to go out in public and for other people to not necessarily know that they've had anything done, just that they look better or that they look like they've been on vacation or they look rested. But I think there is a fine line between achieving a very natural result versus being too radical. I feel that with my extensive training, my expertise, and my continuing education, I'm able to walk that fine line where my patients are extremely satisfied with their results. I take pride in the fact that my practice is very personalized. My patients see me from the initial consultation to the preoperative visit, through the surgery, throughout the surgery, and every post-op visit afterwards. I feel that being a plastic surgeon is a privilege, and I feel that it is my duty and my obligation to a patient to really give an honest opinion of what can be achieved for them. If I'm not able to provide a natural result or a significant change for them, then I would not do the procedure. They know that they're going to leave here looking like the same person, just refreshed or improved.